Hello everyone, welcome to this class. In this class, we are going to learn about mumps and measles. Okay, so I have told you earlier also in influenza viruses that the head family to which they belongs to is myxo family, which is further classified into orthomyxo and paramyxo. So we are going to learn about measles and mumps. So we are going to discuss about paramyxo, and just remember that their character will be syncytial formation. Okay, so here is the diagram. This virus is in helical symmetry. Here you can see it in a rounded form, but actually it is in helical symmetry. Okay, so it contains basically two kinds of spikes on its surface. Okay, so first spike is this red one. It is HN or G glycoprotein. Okay, I have slashed them because not all viruses of this paramyxo family contains all these glycoproteins, but instead they may contain H means hemagglutinin, N means hemagglutinin neuraminidase, and G is simply glycoprotein which helps in attachment. Okay, and there is F which is F glycoprotein. Here I have written which is fusion glycoprotein. Sorry, which fuse host membrane, which is plasma membrane and viral envelope. I have written two times. I'm sorry for that. And right, so they also have this polymerase in them with RNA as genome. Okay, so let us move to the mumps virus first. Okay, so first virus is mumps virus, which is also called rubula virus. Remember this spelling Rubula because it might confuse you from other also, because rubeola, rubella, etc. will also come later. Okay, so first virus is rubula virus, and it contains HN and F glycoproteins on its surface. Okay, see here, this contain only HN out of these three and will contain F glycoprotein. Okay, so also watch this diagram very carefully. This yellow layer is the lipid bilayer or envelope, you can say, which contains M protein inside toward it, and here is its genome, right? So now moving to the transmission of this mumps virus. So it basically transmit from infected to healthy individual through inhalation. Okay, right. If an infective person is talking in front of you or speaking to you in a close proximity, then it can transmit, and it can also transmit through conjunctiva, means through eyes. So which means droplets are also responsible for its transmission. From there it replicate in upper respiratory tract and cervical lymph nodes also. Okay, from there it will move to blood, and from blood to various organ. That's how it, you can say, will cover overall our body. Right, now let us discuss about its disease. So first is parotid swelling. Okay, this is the first signal of illness in the mumps disease. So parotid swelling occurs first in the person. Okay, then comes which is followed by malaise, fever, pain and tenderness in skin, and even inside of our body we will feel tender also. Okay, then comes parotitis, which is non-suppurative, means it is a disease which in which there will be lesions and some pustule formation, but that is without pus formation. Okay, and some complications can also occur like epididymo-orchitis, which is testicular swelling. It means it can be simply orchitis also, and meningitis, meningoencephalitis, right? Meningoencephalitis. Okay, these are the complication, and less common complication are arthritis, nephritis, pancreatitis and myocarditis. Okay, so these are basically what we will see in rubella virus, which is mumps. Now we will go to rubeola virus. Okay, this rubeola is measles, and that rubula is mumps. Okay, remember this, don't forget, it's very important. So same morphology as I have discussed in here. Let me show you this same this morphology. Okay, but this time, where is it? Sorry, this time it will contain F and H glycoprotein, means it have hemagglutinin, no neuraminidase, no G protein, but fusion protein and hemagglutinin protein only. Okay, so they seem spherical, but often they are pleomorphic, means actually they are in rod shape just like a cylindrical, but sometimes they just dissociate from, not dissociate, but they just show some other symmetry also. Okay, they don't seem to be as cylindrical as you want or expect them to be. Okay, so first of all, this is an ancient disease. Yes, it is very true that it is ancient disease, because from very, you can see in the records of our history of the world, that this particular measles affect humans as an endemic epidemic also. Okay, so without any clear distinction from between measles and other extra extra exanthematous disease. Oh, my bad. So basically, some diseases like smallpox, they also shows same symptoms as measles. So we cannot discuss them here. Okay, and when we talk about transmission, then similar to mumps, it can also be transmitted through respiratory tract and conjunctival route. So close proximity talking, inhalation, aerosols, etc. comes under this also. But not like that. It multiplies locally where it gets injected, not injected actually, but from where it comes and enters. In that part, it can multiply locally and also multiply in the adjoining lymph node. Like our body has lymph node in various parts, and you can say that this can move there to the lymph nodes and multiply there as well. From there, it can move to blood, which can cause viremia also. From there, it can go to reticuloendothelial system, and from there to endothelial system. And after it reach the endothelium system, of course, it will cause skin infection, mouth infection, respiratory tract infection, and conjunctiva also. Okay, now we will talk about clinical manifestation. So first and the most important thing is Koplik spot. Okay, so whenever doctor watches the symptoms which are related to this particular small bluish white ulceration on the buccal mucosa, okay, and opposite to the lower molars, means it will be in the upper side, right? I'm sorry, I don't want to do that, but I have this habit to explain. So just see the picture, okay, how these Koplik spots are seen. So after that, we will discuss. No, the patient will suffer from malaise, fever, conjunctival infection, cough, nasal discharge also, right? And right after 4 days of incubation, prodromal illness is seen in patient and rashes appears. Yes, these rashes are the visible features which you can see in measles. Okay, and typically these rashes are in the form of maculopapular rash, which starts from forehead and spread downwards. And after the spread, yeah, they will hurt you, and but they will disappear in same sequence also. And sometimes they, not sometimes, most of the time they leave behind this brownish discoloration of the skin. And of course, just like mumps, measles also have some complications which are pneumonia, otitis media, giant cell pneumonia, meningoencephalitis. And sometimes if a pregnant woman gets this, then it can lead to premature delivery in that pregnant woman. Okay, that's it for this class. Thank you very much and see you soon.